From stories around the world to stories here at home, this is the National News Broadcast. A pleasant evening. I'm Dilanjali Ananda.
I'm Movin Hettiarachi and here are today's headlines. The project 10,000 beds in 10 days is successful. The government has stated that the propaganda stating Sinopharm vaccines have expired is false. MP Harin Fernando has obtained the Sinopharm vaccine. A circular to maintain public service with minimum number of employees will be issued tomorrow. COVID deaths in India are expected to exceed 1 million in another 3 months. The number of deaths due to a bomb explosion in Afghanistan increases to 55. Ushan Tivanka breaks the South Asian high jump record.
For those and other stories in detail. The government has planned to provide 10,000 beds in 10 days to health authorities to treat COVID patients. Minister Nama Rajapaksa is leading the process. Various organizations in the country have been entrusted with preparing beds, and employees of those places are working day and night for the purpose. Minister Nama Rajapaksa yesterday looked into the progress of the program to prepare beds at Tangol, Idipogunagoda area. A private organization in the area is preparing the beds. Meanwhile, beds are being prepared at Mathura Youth Services Council District Office with the participation of the Youth Council. Minister Nama Rajapaksa arrived at the place this morning and observed the preparation of beds. Thereafter, the minister visited Valigama Pradesh Sabha. The minister observed preparation of beds by officials and the employees. Nippon Paint has given its assistance to paint the 10,000 beds. Paint to the value of 1 million rupees was given at Hainville factory premises of the company. Minister Nama Rajapaksa made an inspection tour of the new district hospital at Kotavilla. Discussions were held on getting 2 buildings under construction to treat COVID patients. Attention has been paid on establishing an oxygen generating centre and an intensive care unit. State Minister Kanchana Wijesekara, MP Nipuna Ranavaka and a group of people were present on the occasion.
We have launched a campaign to build or manufacture 10,000 beds in 10 days. Especially, we must reiterate that these beds are not ICU beds, but these beds are for intermediate treatment centers where we have patients who are asymptomatic, and to put them, to take care of them. So at the moment, we get a lot of inquiries saying that patients at home, they have been facing difficulties to find hospital beds. So as a result, we as the Youth Ministry, the Youth Council, and also the Pujjana Peramuna, and all the other relevant organizations and other stakeholders, they have all come forward as one unit to provide these 10,000 beds. I must say that the youth have been very robust in responding to this activity, and they have been very much excited and working very hard for the last few days to deliver this. And already the Yavana Samaja Balamandala, which we have around 300 plus in this country, are working tirelessly to make sure that we reach this target, including trade unions and organizations like NITA, where the children are on holiday, but they have voluntarily come and inquired from the management saying that they want to participate on this program. So we are on a mission, and we want to create these 10,000 beds for intermediate treatment centers. And also, we are looking at possibilities of working with other relevant organizations, the health ministry and private donors, to increase ICU beds and also the oxygen facilities. And also at the same time, we are constructing 13 temporary centers in 13 locations in Mathura district, Kurunagala district, Colombo and Gampha district. And hopefully by Tuesday or Wednesday, we will be able to hand over that. And also, if there is a requirement from the blood bank that they need blood, we as the Youth Ministry and youth of this country is willing to drive that movement to provide it.
Beds are being prepared at Katuba, the Industrial Engineering Training Institute. Minister Nama Rajapaksa visited the place this afternoon and observed its activities. Students of the institute are preparing the beds. Mayor of Moratuwa Municipal Council, Saman Lal Fernando, was present on the occasion.
Meanwhile, State Minister Professor Channa Jayasumana says that media reports stating the Sinopharm vaccines received from China have expired are totally false. Expressing his views to the media, the state minister said the vaccines would expire in 2023. State Minister Professor Channa Jayasimana said that the vaccines have been produced recently. A vaccine has not been prepared anywhere in the world that would expire soon. It will take another 2 years for the Sinopharm vaccines given by China to expire. Therefore, it is a total false statement. He said that people will be never given expired vaccines. The vaccines cannot be bought arbitrarily. The vaccines are given to people after inspection by the National Medicinal Drugs Regulatory Authority and with the permission of an expert committee.
ජනතාවට අපි ලබා දෙන්නෙත් නැහැ මේ ප්‍රචාර දියත් කරන පුද්ගලයන් පිළිබඳව විශේෂ විමර්ශනයක් කරන්න ඒ වගේම ඔවුන් වරදක් කරනවා නම් උන්ට දඬුවමක් ලබා දෙන්නත් අප කිසිසේත්ම පැකිලෙන්නේ නැහැ අපි ජනතාවගෙන් ඉල්ලා සිටිනවා මේ තියෙන්නේ අපේ රජය පිළිබඳ විශ්වාසය පළුදු කරන්න ඒ වගේම එන්නත් කරන ව්‍යාපාරය කඩාකප්පල් කරන්න කරන උත්සාහයක් මිසක් වෙන කිසිම දෙයක් නෙමෙයි මේවට රැවටෙන්න එපා මේ එන්නත් හිතුමතේට ගෙනහලා දෙන්න බෑ මේ පිළිබඳව ජාතික ඖෂධ නියාමන අධිකාරිය පරීක්ෂා කරලා ඒ විද්වත් කමිටු මගින් අවසරය දීලා අනුමැතිය ලබා දීලා එකින් එකට පරීක්ෂා කරලා තමයි මෙමෙ එන්නත් අපි ජනතාවට ලබා දෙන්නේ ඒක නිසා COVID-19 රෝගය සඳහා එන්නත් ලබා ගැනීම සඳහා බියක් ඇති කරගන්න එපා කියන ඉල්ලීම අපි ජනතාවගෙන් සිදු කරනවා.
Inoculation of the Sinopharm vaccine commenced yesterday. It was given today at Horana Gurugoda Mulberrygama Temple. About 1,000 people in the Gurugoda Grama Niladhara division have been given the vaccine. Sinopharm vaccine was given to the first time today for the people in Gambha district. It was given at Yakkala Keselwatugoda temple. The vaccine is scheduled to be given to people in Galtodumulla, Keselwatugoda and Vidyavitha Gramya Niladhara divisions. Sinopharm vaccine was given today at Moratuwa Soisapura Community Hall. 600 people at the North Televala and South Televala Grama Niladhara division were given the vaccine. Sinopharm vaccine was given today at Narampiti and Grama Niladhara division under the Panadura police area. The vaccine has been given to 340 people between the ages of 50 to 60 years. Distribution of the Sinopharm vaccine took place today at Kirulpana. 600 people have been vaccinated. Samagjana Balavegya MP Harin Fernando was inoculated with the Chinese Sinopharm vaccine today at Kirulapana. Sputnik 5 vaccine was given today for the 4th time. It was given at Velampitiya Koduvilla Temple. 1,200 people have been given the vaccine today. Several ministers expressed their views about the COVID-19 vaccination program.
A decision was taken today to maintain public service with a minimum number of employees. The decision has been taken today following a discussion between head of the Presidential Task Force, Basil Rajapaksa, and ministers, ministry secretaries, health and security authorities. Secretary to the Ministry of Public Administration, Provincial Councils and Local Government, J.J. Ratnasiri, has informed heads of organizations not to call pregnant mothers for employment. He said that the relevant circular will be issued tomorrow. Secretary to the Ministry of Public Administration, Provincial Councils and Local Government J.J. Ratnasiri said that head of the Presidential Task Force Basil Rajapaksa held a meeting with relevant ministers, department heads, ministry secretaries, health and security authorities. Decisions were taken at the meeting on maintaining essential state services and measures to be taken to prevent the spread of COVID-19. It was decided to call a minimum number of staff members to maintain essential services. The heads of organizations have been empowered to decide on the necessary staff. The relevant circular will be issued tomorrow. It is expected to mention not to call pregnant mothers for service activities. If government and private institutions follow this, it will be possible to prevent gathering of people and the spread of the virus. A total of 1,732 COVID-19 patients were detected today.
චක්ලේඛනයක් ලිඛිත කරන්න බලාපොරොත්තු වෙනවා විශේෂයෙන්ම මේ කාරණේදී ගර්භණී කාන්තාවන් සේවාවන් වලට කැඳවන්න එපා කියන එක විශේෂයෙන් සඳහන් කරන්න බලාපොරොත්තු වෙනවා විශේෂයෙන්ම රාජ්‍ය දෙපාර්තමේන්තු අමාත්‍යාංශ සහ රාජ්‍ය අනුබද්ධිත ආයතන පුද්ගලික අංශයත් මේ විදිහටම කටයුතු කරනවා නම් මම හිතනවා අපේ මූලික පරමාර්ථය මේ රෝගයේ වැළැක්වීම සඳහා සහ මහ ජනතාව එක්රොක් වීම වැළැක්වීම ඉතින් ඒ නිසා පුද්ගලික අංශයත් ඒ අනුව ඒකට අනුගාමික වෙලා කටයුතු කරනවා නම් සුදුසුයි.
A total of 1,732 COVID-19 patients were detected today. Meanwhile, 1,365 discharged from the hospitals yesterday following their complete recovery. So far, the total recoveries in the country has increased up to 104,463. A total of 19,717 COVID-19 patients are still receiving treatments in hospitals. Steps have been taken to close Piliyandala public market after finding COVID-19 patients. Piliyandala Medical Officer's office said that the decision was taken after identifying 101 COVID patients following random PCR tests. An urban councillor of the Kasbaba Urban Council has been infected with COVID-19. Piliyandala Medical Officer's office said that Mayor of the Urban Council and 33 councillors were sent for quarantine. Following rapid antigen tests at Kalutara, Ethana Mandala area yesterday, 34 corona patients have been found. Health Minister Pavitra Vaniyarachi has appointed 9 Deputy Health Service Director Generals to coordinate COVID control program at provincial level. The minister has instructed them to visit all provinces and to provide necessary facilities. A special discussion on corona control in the Kandy district took place today at the district secretariat under the patronage of Minister Kehelia Ramukwala. Public representatives, health authorities, heads of local bodies, doctors and division secretaries attended the discussion. The minister has instructed them to provide necessary facilities and health equipment soon to control the COVID pandemic. Instructions have been given to control the COVID pandemic. Instructions have been given to upgrade equipment and hospital facilities for the patients. The minister has instructed the health authorities to take steps to select suitable places to set up treatment centres and to prepare them. A 2,000-bed COVID treatment centre is being built at Yakkala, Varallavatta area. Ministers Prasanna Ranatunga and Nama Rajapaksa recently inspected the constructions. Constructions of a new ward of COVID treatment unit in Koskama Regional Hospital have commenced. The ward with 5 beds is being built with the direction of Sri Lanka Pudujana Peramuna National Organiser Basil Rajapaksa and with the supervision of regional party leaders. The ward is scheduled to be opened on the 11th. Colombo District Development Committee Chairman Pradeep Undigoda, Director General of Sri Lanka Rupavahini Corporation Ajit Naragala, of Sri Lanka Pudujana Peramuna Avisavela organiser Ravindra Rajayasinghe inspected the constructions. The government has paid attention on recovering Gomaran Kadavala Regional Hospital into a COVID treatment hospital. MP Kapila Nuwan Atukorala made an inspection tour at the hospital. A group of Health Ministry officials and Deputy Director General of Medical Services G. Vijay Surya visited Ambalangoda Polvata Rural Hospital yesterday to enhance facilities of the COVID treatment centre, which is being maintained at the hospital. Attention was paid to increase the number of beds to 101 and to deploy more staff. Police said that 426 persons who ignored health protective measures were arrested during the past 24 hours. A total of 6,965 have been arrested in connection with the offence. 22 COVID deaths were reported yesterday from the country. The deaths have been reported from Ragama, Kadawatha, North Mulleriyawa, Talawathagoda, Moratuwa, Lunuketiya, Maditta, Padiyapadalla, Colombo 8, Bulat Kuhupitiya, Hunnasgiriya and Katugas Tota. Deaths were also reported from Halangoya, Horampalla, Ganemulla, Gurundeniya, Kadawatha, Bibila, Agalavatta, Valahanduwa, Poddala, Galagedara and Gannoruwa areas. Minister Professor G. A. Piri says he expects to meet a group of epidemiologists and educational experts on Wednesday to get advice on opening schools, peer events and universities. Dole Kanda Rambukarada, Katalana, Tanavela, Ibulkanda, South Potupitiya, Ramaseva divisions of Rakwana police area in the Ratnapura district were isolated today. Panapola, Kudumiriya, Kudava, Delgoda East, Delgoda West, Davugalagama, Ganagalagamu and Koswat, Gram Nilatari divisions in the Kalarwana police area have been isolated from this morning.
Meanwhile, the worldwide coronavirus caseload has topped 157.7 million, while the deaths have surged to more than 3.28 million. Meanwhile, the COVID-19 deaths in India could potentially reach a staggering 1 million by August 1st this year, according to an editorial in the British medical journal Lancet. Minister Dr. Bandula Gunawardena says that Lanka Sathusa has a mechanism to provide food items for any need. The minister said goods required for 1 month are at the stores. The minister mentioned this during an inspection tour of Lanka Sathusa wholesale store in Galle yesterday. The minister looked into the health protective measures and the distribution of goods. More attention was paid on the health protection of employees and maintaining necessary stocks of goods. Minister Dr. Bandula Gunawardena said that there was no store complexes in Galle. He said that the work on the complex was commenced after assuming the office. There is a shortage of structure to distribute goods in island-wide. It has been prepared to face any emergency covering all provinces. The minister said it was better to maintain essential services without a lockdown of the country.
The series of religious programs Vishwa Ashirwad Horava was held yesterday at all places of religious worship, wishing the eradication of corona pandemic from the earth. The programs have been organized on a concept of President Gotabaya Rajapaksa and Prime Minister Mahinda Rajapaksa. A Vishwa Ashirwad Horava program was held at Polonnaruwa Galvihara premises under the guidance of Venerable Galketidammane Attadasi Thera. A group of people, including Polonnaruwa District Secretary W.A. Dharmasiri, were present at the program. An Ashirwada Pahan Puja and chanting of Ratna Sutra took place near the lower precinct of Botri of the historic Mahasaman Devala premises in Ratnapura. A group of people from the area and the Mahasangha were present on the occasion. Chanting of Ratna Sutra took place at Mathura, Palatuva Bauddhoda Piriven Temple. It was held under the patronage of Chief Prelate of the Venerable Gatamanne Gunananda Thera under the health protective guidelines. A Ratna Sutra chanting and Abatel Pahan Puja took place at Mahiyangana Raja Mahaviharasthana. It has been organized under the patronage of a member of the senior Karaka Sangha Sabha of the Askiri chapter and Rajakiya Pandita Venerable Urulavatte Dhammarakita Thera. A group of people, including State Minister Tenuka Vidanagamage, attended the ceremony. An Ashirwada Pahan Puja and chanting of Ratna Sutra took place at Nathandiya Veerahena Vidyaratna Piriven Temple. It was held on the instructions of Rajakiya Pandita Venerable Nivandama Dhammadissa Thera. Vishwa Ashirwada Horava and chanting of Ratna Sutra took place at Vaunia Madhukanda Historic Sri Dalada Temple. It was held under the patronage of Chief Prelate and Chief Sangha of Northern and Eastern Provinces Venerable Muva Atagama Ananda Thera. Parliamentarians Kaldar Mastan, Kulasingham Dileepan and Vaunia District Secretary S.M. Saman Bandulasena were present at the religious function. Venerable Buttala Sumangala Thera conducted religious practices near the Kalathura Historic Botri. Members of the Kalathura Bodhi Trust Board were present on the occasion. Ratna Sutra and Jwara Pirita were chanted in Hanguranketa Madanvala Raja Mahaviharya. It took place under the patronage of Nuwara Eliya District Adhikara Sangha Nayaka Venerable Deltuta Chandrananda and Chief Prelate of Madanvala Raja Mahaviharya, Venerable Vallagiriya Sumangala Theros.
A look at a local news report.
Nuwara District Coordinating Committee Chairman, Parliamentarian S.B. Disanak and District Secretary Nandana Galaboda were present on the occasion. A puja was held at Batiklo, Kalanchudi Sri Manika Pillayar Kovil. It was held under the guidance of Sri Suman Sanmu and Manika Pillayar Kurukal.
A look at several more news stories. A South African suspect was taken into custody this morning with cocaine valuing 60 million rupees at Bandaranaike International Airport. The suspect arrived in Colombo from Nairobi, Kenya. 2 kilograms of cocaine have been taken into custody. He had hidden the drugs cleverly in his baggage. Investigations are continuing into the 62-year-old suspect. The road from Fraser Avenue to Dehivala railway station is being developed. 428 million rupees is planned for the development activities. The aim is to minimize traffic congestion in the Gaul Road. Colombo District Secretary Pradeep Yasaratna made the observation tour of the area yesterday. Laying of sand near Jayashree Mahabodhis took place for the 42nd time yesterday with the sponsorship of the Bank of Ceylon. It has been organized on the instruction of the Chief Prelate of the Atamathana, Venerable Pallegama Srinivasa Thera. Deputy General Manager of the bank, P.L. Silva, North Central Province Assistant General Manager, Mahinda Bandara and a group of devotees were present at the occasion. That's it for tonight's English News Update. Thank you for joining us. Good night.
Good night.